Oh, hey, Jimmy.
Hey, how are you doing?
Good, how are you?
Good, good. Are you ready for your questions?
Yes, come on in.
Thank you. All right, first off, what is your name?
My name is Felicia Mix.
All right, where are you from?
I'm from St. Michael, Albertville, Minnesota, small town.
What is your level of training?
I'm a fourth year in medical school. I'm graduating in 2 weeks.
Whoa, congratulations.
Thank you, thank you.
Where did you go for undergrad?
I went to the College of St. Benedict in Minnesota.
Awesome, okay. What medical school do you attend?
I go to Burrell. It's an osteopathic school in Las Cruces, New Mexico.
And where will you be going after medical school?
I'm very excited. I'll be going to a transitional year staying here in Las Cruces at Mountain View and then heading over to the University of Miami for PM&R. Yeah, I have to go water my plants.
Why did you decide to go to DO school?
Ooh, great question. I think the whole reason why I wanted to be a doctor had to do with kind of seeing a physician put their hands on a patient and help a patient. So that was kind of my first experience with becoming a physician. And so I think DO school just felt natural with the osteopathic component.
Great answer. What made you first fall in love with medicine?
Ooh, growing up, actually, one of my best friends, he was diagnosed with pediatric rhabdomyosarcoma. So I spent a lot of time at Children's Hospital with all of our hockey pals.
What has been your favorite part of medical school?
Ooh. I mean, I love it all. Probably clinical rotations. I love being out and doing the real thing.
Okay. What has been your least favorite part of medical school?
Probably that first semester. I hate to say it, but like a lot of the immunology, that kind of stuff.
That's fair. What did you think you wanted to specialize in at the beginning of medical school?
I had a lot of ideas. First, pediatrics. I was also kind of thinking OB, maybe anesthesia.
What made you interested in PM&R?
Yeah, so when I was on my clinical rotations, I loved everything, which I think a lot of students say. And I really started to evaluate kind of what type of patients I like. So on my pediatric rotation, I loved all the sports med kiddos coming in with like a swimming injury, the cerebral palsy patients, that kind of thing. Family medicine, I loved all of those sports med patients. And internal medicine, I loved the stroke patients. And so I kind of started to see the type of patient I liked and then the type of care I wanted to be for them. So I loved kind of helping that transition back to home. And then naturally, I found PM&R.
Awesome, okay. For those who don't know, what is PM&R?
Ooh, yes. So PM&R is a specialty of function. So we look at patients during some of the worst times of their lives, whether they just had a stroke or a traumatic brain injury, or even, like I said, a kiddo who just hurt their shoulder swimming. And our job is to improve functionality. So how can we make them feel better to transition back to life? So whether that's collaborating with therapists, such as speech therapists, physical therapists, occupational therapists, or that's doing different modalities like OMM or different injections, just to make them feel better. And also working with prostheticians and orthoticians to get them orthotics and prosthetics to get back to living their life.
What have you been involved in with PM&R?
Ooh, a lot. I think probably my biggest thing would be AOCPMR. I'm a chair of the conference committee right now. I'm co-chairing it with 2 other great women. So that has been really fun. We're planning a conference right now that's going to be in Tampa. So getting everybody together to network.
Okay, that sounds like a great time.
Yeah.
Are you looking to specialize in PM&R?
You know, I've thought about this a lot, and every week I change my mind. Right now, I could really see myself doing kind of like that sport and spine clinic, maybe working with some like weekend warriors that hurt their shoulder or their back. But also, I love stroke, TBI, and inpatient. So I'm going to change my mind a lot in residency too.
What do you think is the most unique aspect of PM&R?
You know, something I realized as a student that I think is very unique to PM&R compared to all my rotations is the types of questions that the physiatrists ask their patients. So on all of my PM&R rotations, they ask, without a doubt, what do you like to do for fun? Or, you know, the basic questions like, is your house a 1-story or 2-story house? How many stairs to enter the home? So I think what's really unique about PM&R is we're not looking at the patient just in our clinic or in our hospital, we're looking at what is their life outside, because that's ultimately where they're going when they're leaving us. So how can we help them be their best self outside? And so I think those questions that we ask them is very unique.
Got it. Okay. How do you think learning DO principles will help you with becoming a physiatrist?
Yeah. So I think osteopathy meshes so well with physiatry. So a lot of our principles, like the body is a unit and we're self-healing and self-regulating, I think all of that really fits in with PM&R because, for example, PM&R residency, we focus on like gait mechanics and things like that. How does someone having a misalignment in their hip affect their knee, affect their ankle? So I think all of those, like our philosophy definitely meshes well into how we're going to view our PM&R patients, as well as just that osteopathy component, right? So I've used OMM the most in all my physiatry rotations, just getting your hands on the patient and seeing where it hurts, not only for treatment, but also for diagnosis. So
that's great.
Yeah.
Are you nervous about starting residency?
Actually, right now I'm so excited. Like I don't have any nerves yet. I mean, maybe they'll come soon, but right now it's just pure excitement. Like very excited.
I'm so happy for you.
Thanks.
What are you looking forward the most in residency?
I think probably finally having more autonomy with my patients. I think I'm definitely, I always say, put me in, coach, in my medical school rotations, where you kind of have to, you have a little bit of autonomy as a medical student, but as a resident physician, I'll get a little bit more. So I think I'm really excited for that, kind of making decisions with my patients.
All right. Aside from PM&R, what have been your favorite rotations as a medical student?
Actually, plastic surgery. I did a reconstructive plastic surgery rotation where we got to do like gastrocnemius flaps and really cool flaps. I think the anatomy component I just really liked. So yeah, probably plastic surgery.
Okay, that's great. All right. And then what do you think you would miss the most about medical school?
Probably just that like learning environment of medical school. I mean, everywhere, everyone's trying to teach you something, right? And you're labeled as that student. So walking around in my short white coat in the hospital or walking around in medical school, I mean, everyone wants to teach you. So I will really miss just that learning environment of being labeled a student.
Got it. Okay. All right. So I know you have a life outside of medical school. What is your favorite thing to do when you're not studying or working?
Ooh, anything active. I am kind of crazy. So whether that's hockey, hiking, mountain biking, playing soccer, anything active, lifting weights.
Okay.
Yeah.
Any artistic hobbies that you're invested in?
Ooh, I'm not that artistic. maybe gardening, is that artistic? I'm not that artistic.
Are you a morning or night person?
Definitely morning. I'm like a 4 a.m., 5 a.m. type of person.
All right. Do you have any pets?
I do. I have one puppy. Her name is Kiwi. Well, she's not a puppy. I guess she's 2, but she's a golden retriever and she's super cute.
Okay. What is your favorite dish to eat?
Dish, huevos rancheros. Snack, popcorn.
Oh, that sounds great. What is your Chipotle order?
Ooh, brown rice, both beans, so pinto, black, fajitas, lettuce, pico, like the tomato salsa, and that's it.
Okay. All right. And then if you could travel to any place in the world right now, where would it be?
Ooh, just last night I was looking up trips to Peru. I don't know why, but working on my Spanish, so.
What is your most used emoji?
The birthday emoji with like the birthday hat and the string, like, what is it called? Like the thing that is in their mouth. But I love being people's cheerleaders and cheering people on, so I use that a lot.
If you had your own talk show, who would be your first guest?
Oh, this is hard. Who would be my first guest? Lately I've been really into looking at CrossFitters, and I've been watching all these blogs on Brooke. I think her name's Brooke Entz, so I'd probably bring her on to see like, how do you work out for like 8 hours a day and still be human?
And TV show that you would not mind binging again?
I'm sad to admit I don't really watch TV. I'm really bad at it. So I don't know. I'm horrible. I'll sit there for like a minute and then I get up.
That's okay. What is your favorite item that you bought this year?
Item. That's hard too. I don't know if it's like the millennial in me or it's because I'm broke medical student, but I don't buy a lot of things. Can I pick a thing that I bought like that was an experience?
Sure, yeah.
Okay, we bought tickets to Cirque du Soleil and that was so much fun.
That's great.
Yeah.
What is the last concert that you attended?
Pre-COVID, I went to something called Hairball. They're like a rock band that redoes like Metallica and Queen, and it's a lot of fun. They dress up like them. It's fun.
Awesome. What was your first job?
Actually, a swim coach. Yeah, I think I was 14, and I
Wow.
got certified, and yeah, coached swimming.
First thing you would do as the President of the United States?
I know this one for sure. Forgive student loan debt. Definitely forgive student loan debt.
Love it. What sport would you compete in if you were in the Olympics?
Winter hockey, summer swimming.
Okay. Got it. Would you rather have the ability to fly or the ability to be invisible?
Definitely the ability to fly.
What is the best piece of advice you've ever been given?
This is probably from my mom. Don't close doors on yourself. Let other people close the doors on you.
That's great advice.
Yeah.
What is one thing that not many people know about you?
I like dog training. I'm really into training dogs.
All right. Is there a different specialty that you think you could have done?
You know, I was asked this on interviews. I think some sort of thing with like weight loss or like lifestyle management. I love just like talking to people about how they can feel better, which is probably the PM&R in me. But if I could do that from a different viewpoint, probably, yeah, helping people, I don't know, learn how to lose weight and eat healthy and work out.
Okay, great. And that kind of segues into the next question. If you didn't do medicine, what do you think you would be doing right now?
Personal trainer. Not as I am now. I would need some help.
Can you describe a challenging moment that made you reconsider your career path?
Yeah, so my first semester of medical school was really tough. Wasn't doing that well in classes. Failed a test. So I think then, you know, you kind of sit there and think like, why am I doing this for sure? But it was the support from my school and my friends that really, really helped me, so.
Okay. Looking back, do you think you would have done anything differently in medical school?
You know, as hard as like the hard times was, I think cliche enough, it definitely helped me to become who I am today. So probably not. Probably wouldn't change anything.
Then where do you see the field of PM&R going in 10 years?
Yeah, so I think there's a lot of different directions. I think right now we're kind of that like hidden specialty that a lot of people don't know about. So I definitely think it growing and becoming more accessible to a lot of people going through something like a sports injury or, like I said, like a stroke. So I think the accessibility will just increase in the knowledge of our field for sure.
Awesome. And how can students interested in PM&R be more involved?
So definitely join AOCPMR. Sign up to get a mentor. It's free. That really helped me. Just hooking in with all of the organizations. So there's AAP, AAPM&R, or your school. Your school might have an organization. So definitely just hooking in with those people. What I even did was just anyone I knew who was a physiatrist, I would email them, call them, however I could contact them, have a chat with them, and then once I was done with that chat, I would say, hey, do you have anybody else you can put me in contact with? And that's how my network grew.
Awesome. And last question. Any other general advice would you say to a student pursuing PM&R?
First of all, you pick the best specialty, but also be an advocate for yourself. Not only that, but also for others. I think PM&R is such a unique community, and when I involve other people and just be there for my friends and advocate for my friends, we're all gonna be better off. So yeah, advocate for yourself, advocate for others, and you picked a good specialty.
Awesome. Thank you so much, Felicia.
Yeah, no problem.
Good luck in residency.
Thank you so much.